Fracture of the tibial shaft, the main leg bone. It often occurs secondary to falls, motor vehicle accidents, sports, and other outdoor activities. But trauma from military service often causes a tibial shaft fracture as well. In this video, I'll discuss this fracture, how it's usually treated, and the possible long-term consequences of the injury. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. A fracture of the tibial shaft occurs usually secondary, again, to falls, motor vehicle accidents, sports, and other types of outdoor activities that cause trauma. It can especially occur with motor vehicle accidents and sports in males. The most important factor in terms of long-term issue with a tibial shaft fracture, especially if it's an open fracture, and this is what we used to call a compound fracture, where the tibial shaft is open to bone, is early administration of antibiotics and then surgery to go in and clean out the infection, what we call an irrigation and debridement. That can be done at bedside, but it typically involves going to surgery and doing that, cleaning it out, and then basically doing the treatment for the fracture. Now, there's different treatments. Some can be treated without surgery, typically not in adults, because there's a very sort of narrow window of acceptable alignment in adults. In the past, way more were treated non-surgically, treated in a cast than you typically see today. But if there's any amount of displacement, shortening of the fracture, something like that, it can basically be reduced, closed to line it up, and potentially treated with a cast, but that's not typically what's done anymore. Typically, we do treatment. That is typically what's called an intramedullary rod, where a rod is placed down the center of the bone. Sometimes, depending on the location of the fracture along the tibia, it can be what's called an open reduction internal fixation with plates and screws. That's not typically more common than the rod, because one of the great things about placing a rod down it, if that can be done, is that you can bear weight on it much earlier. But if it's a fracture that it goes up into, say, up close to the knee joint, the tibial plateau, or down towards the ankle, sometimes a rod, an intramedullary rod or intramedullary nail is not the treatment, and you have to do the plates and screws. Now, in terms of long-term complication, there's a number of different things. Compartment syndrome, where the muscles start to swell, and that puts pressure on the nerves that run through that area and the blood vessels. Very, very limb-threatening complication, and I've done videos on that before. That's a potential complication and a need for very urgent surgery. And then long-term, things like anterior knee pain or pain in the front of the knee, usually from where the rod is placed. The fracture may not heal, either a delayed union or a non-union, or it may not heal lined up very well, what we call a malunion. Studies have shown that patients initially improve. You have a significant decrease in function initially, but you typically get better over the next 6 to 12 months. But even years down the road, studies have shown 5 years later, you still may not be back to the same level of function you were before that initial fracture. One study showed that 12 years after you have intramedullary nailing of a tibial shaft fractures, your functional scores may still not be at the level you were before you got hurt due to persistent knee pain. Again, some of the complications, especially with nail fixation of the fracture, compartment syndrome, malunion, non-union, and anterior knee pain. And I see that a decent amount among veterans with long-term issues related to a tibial shaft fracture that occurred during military service. If you have ideas for topics for future videos for this Veterans Nexus Letter channel, whether that's injuries or risk factors for injury, the disability claim process, or anything else, leave those in the comments below those videos. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below. You can learn more about working with me and working with my team. We do everything we can to make the process simple. We try to make it as quick as we can for sure for you. And I really try hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.